Assalamualaikum to our respected lecturer Dr. Ardyanti as our supervisor, as well as to our examiner Sir TUNKU NASHRIL and Dr. ZAINI. This research was conducted mainly by two researchers. The first researcher is NURUL SYAFIKA binti JAMALUDIN and the second researcher is NURUL NAZIRAH binti BAKAR. Today we would like to present on our Viva presentation titled The Mysalam Scheme and B40 Household, a case study of healthcare assistance from Sen'S capability approach in Kedah. We personally hope our examiner enjoy on our Viva presentation.
Mysalam among the healthcare assistance given to the Malaysian, which it is a healthcare scheme provided by the governments to help the poor and needy to overcome their financial difficulties in an unexpected event of a critical illness. Mysalam is part of the government initiative to assist and facilitate the lower income group, which refers to the B40 households, to have a normal lifestyle despite of their financial challenging due to their critical illness. Mysalam scheme was introduced in 2019 and the B40 household can apply for this Mysalam scheme in March, and this scheme is eligible for those who was diagnosed in one of the 45 critical illness that is stated in the Mysalam website. Moving on to the problem statement. Okay, recently this healthcare provision that been provided by the government become a major concern to the public due to the pandemic COVID-19 that shows a high rates of deaths around the country in the world. Even so, the budget allocations is inadequate as only 2% were spent on the healthcare, and also it becomes stressful for the low income group, which they must spend their money to their family members that suffer from chronic illness. For instance, a study shows that most of the family's members that spend a lot on the healthcare is rendered insolvent, which shows a 35% of total healthcare expenditure. Therefore, there are increasing trends which if the people want to have a better treatment, they have to get in an expensive way. For instance, for the richer, they can get better treatment in a private facilities. However, for the poor, they cannot afford to get the treatment, and also they will withdraw their treatment. Due to the problems that I have stated, the Malaysian government has introduced these Mysalam schemes. However, this Mysalam scheme also shows some problems whereby these Mysalam schemes were widely distributed to the B40 households. However, this Mysalam scheme is still insufficient to support their medical needs. According to Bernama News 2019, it had stated that a one-time cash payout may increase the health of the society and access to the facility, but it may not improve the well-being of the B40 household unless they have expanded their capability to the B40 household of what they wanted to be. For instance, the capability to access the healthcare scheme at any time. Next is the research question, or known as RQ. In this study, we have identified about 3 research questions. The first research question is, how do the B40 household understand about this healthcare scheme, which refer to the Mysalam, that have been provided by the Malaysian governments? The second research question is, why do the B40 households think that this Mysalam scheme is necessary for the less fortunate income group? And the last research question is, how does this Mysalam scheme can help to improve the well-being of the B40 households? The research objective of this study is referred to the research questions. Okay, so the first objective is, it is to examine the understanding of the B40 households about these healthcare schemes that have been provided by the Malaysian governments. And the second objective is to examine the importance of these Mysalam schemes to the less fortunate income group. And the last objective is, it is to examine the capability of these Mysalam schemes in improving the well-being of the B40 recipients. Next, we move on to the research methodology, where the research design, we have chosen the qualitative methods in this study, where we have using the semi-structured interview development, where the data collections is collected in a particular times to answer all of the research objective. And for our unit of analysis, we have chosen the B40 households due to this Mysalam scheme is provided to the low income group, which refer to the B40 households, and we have chosen a certain area in Kedah, that is Sungai Petani, Merbau and Bidong. And for our sample size, we have averaged the population in Sungai Petani is about 339,898 population in this Sungai Petani. And for our sample size, we have ranged about 20 to 30 respondents. So due to our saturation level, we have chosen 20 respondents that been interviewed. It is because this 20 respondent is sufficient to fulfill our research questions and its objective. Next is the sampling technique. In this study, we have used the purposive sampling, where it is non-probability sampling approach, where this sampling does not allow the research to generalize to a populations. Okay, according to pattern and pay list, there is a list of some prominent types of purposive sample that have been identified for sampling qualitative research, which provide different sampling approach that may be found. As I have stated, we have using the qualitative methods where we have used the semi-structured interview developments, where it is a combination of a list of questions or topics that will be asking to the respondents and some unstructured interview where it will be spontaneous questions to ask to the respondents to avoid some awkward or boring situations. Okay, for the data collections, as we have stated, we have using the semi-structured interview, and due to that, we have face-to-face and online in-depth interview, but still in the form of asking questions to the respondent that received this healthcare scheme of Mysalam. And we have this interview will be in structural form, where we start with the demographic questions and then proceed with our research questions. After finish collecting our data collection, we will use the Endeavour 12 software for our data analysis to come out with a thematic analysis. Okay, this thematic analysis is referred to a conceptual patterns of data that relates to our study, that is Mysalam's. Okay, this thematic analysis will be created by the researcher itself after the process of data familiarizations, data coding, topic formation, and team modifications. Next is the conceptual framework. Okay, in this study, we have adopted the Amartya Sen's capability approach theory in 1999. Okay, this capability approach theory is to enable to provide an overview about the individual well-being and social arrangements, the designs of the policies and proposal about social change in the society. This study we have using this capability approach theory is to evaluate the well-being of the recipient that had applied for this Mysalam scheme provided by the Malaysian government to the B40 household. From this figure, we have identified several conversion factors, that is individual, socials and environments, which relates to this Mysalam scheme, and also the well-being of this B40 household, where it may make it difficult to the people to expand their functioning, such as the ability to convert this assistance into something that they value. This will be further explained in the case of the Mysalam scheme and its relations to the well-beings of the B40 households in Kedah, Malaysia.
Next, the research finding. The research finding of the study are presented according to the research objective. Before discussing on the first objective, Table 1 present the demographic profile of Mysalam B40 household recipient. It deliberates in terms of age, gender, occupation, income per month, and type of disease. This is vital in providing an earlier overview of the Mysalam recipient background in this study. All respondent interview came from district in Sungai Petani, Merbuk, and Bidung, Kedah. This area was chosen as the study focused on the recipient living in semi-urban areas. Some of them are come from the different ages, 20, 30, 40, 50 and 60. In terms of education, both male and female respondents in this study have completed their education until SPM level. Most of the respondents suffered from chronic disease such as stroke, leukemia that enabled them to receive Mysalam scheme. Next, finding for research objective 1 to examine the understanding of B40 household in the healthcare scheme Mysalam provided by the Government of Malaysia. There are two themes generated from research objective 1, government assistance and healthcare assistance for B40 household. For the theme 1, government assistance was mentioned frequently by the respondent. One of them was a respondent 1 who in his 20s acknowledged that Mysalam scheme was a government assistance provided for the B40 household to reduce financial burden among the low-income groups. His sentiment was shared by respondent 5, who in his 30s is a rubber taper that suffered from HIV infection, agreed that Mysalam scheme is a government financial healthcare assistance to prevent chronic disease faced by B40 households. The second theme under the first objective is healthcare assistance for B40 household, which was highly mentioned by the respondent. For instance, respondent 9, who is in her 20s, is a factory worker that suffered from leukemia disease, acknowledged that Mysalam scheme was able to reduce financial burden among the B40 household. This is also supported by respondent 11, who is in her 40s, is a technician that suffered from kidney failure, agreed that this healthcare assistance for B40 household helped them in reducing the burden of paying medical expenses. Basically, all respondents understood that Mysalam scheme is a government assistance that is effective to provide better financial treatment despite their income. Therefore, it is agreed that Mysalam scheme is a government assistance that is a vital means to access healthcare in the society, fundamentally crucial to better health outcomes. Next, Finding for research objective 2, to examine the importance of the healthcare scheme Mysalam for the less fortunate income group. There are 3 themes generated under this research objective: reduce financial burden, provide financial help protection, and beneficial to B40 household. For the theme 1, reduce financial burden, was highly mentioned by the respondent. For instance, respondent 19, 2 and 13 agree that Mysalam scheme is sufficient to reduce financial burden by way of supporting their medical costs through free treatments and treatment discounts. The second theme under the second objective is providing financial help protection. For instance, respondent 13 agree that Mysalam scheme gave financial help protection whereby direct payment is made to obtain health services. His sentiment was shared by respondent 14 and 4 that acknowledge Mysalam scheme gave financial help protection through Mysalam Trust Fund, providing protection against loss, damage that is caused by debt. The third theme under the second objective is beneficial to the B40 household. All respondents agree that Mysalam scheme gave a various benefit to them. This is supported by interview finding, whereby respondents 10, 12 and 6 acknowledge that Mysalam scheme shown a good impartial attitude, especially for their health condition, through free medical treatment that resulted to the less risk of experiencing serious depression. Basically, Mysalam fulfilled the needs for necessity as calculated by the respondent. Most of them applied it to support their living as it helped them to resume back to the normal lifestyle. Next, finding for research objective 3, to examine the capability of the healthcare scheme Mysalam to the B40 recipient in improving their well-being. The first theme is increased well-being, which was highly mentioned by the respondent. For instance, respondent 15, who is in his 60, supported that Mysalam scheme improved his health. Respondent 17, who is in his 20, suffered from stroke, agreed that Mysalam scheme was able to improve his health and well-being where better treatment is received from a doctor. Respondent 9, who is in her 20s, acknowledge that Mysalam scheme should be taken by B40 household to increase their well-being. Under the second theme, respondent had highlighted the limitation of Mysalam recipient in assessing Mysalam scheme. The capability of Mysalam recipient in claiming this scheme at the healthcare center is being measured. Most of the respondents shared that having vehicle helped them to claim the scheme at the clinic or hospital. For example, respondent 1 mentioned that having a car enabled her to claim the scheme. However, some did mention that they did not have any vehicle to claim Mysalam scheme, such as respondent 3, which is harder for him to go to the healthcare center. Besides, most of the respondents shared that the distance between their house and healthcare center is not that far. For instance, respondent 18 mentioned that the distance is not that far, it is about 3 kilometers away. However, some did mention that the distance is quite far. For instance, respondent 6 mentioned that the distance is quite far, it is about 10 kilometers away. Basically, almost half of the respondents had a good experience in claiming Mysalam scheme, since environment factor did not affect them. However, it is inconvenient for some people that live in rural area to go out without any transportation to claim the Mysalam scheme. Next, recommendation. Firstly, the government need to enhance Mysalam scheme in terms of promoting it, as in Sabah, for example, many were still unaware of the existence of Mysalam scheme. Secondly, setting up an independent committee to review Mysalam scheme, which can be overlooked for those who are not receiving it. Thirdly, improving the accessibility of the healthcare center. Perhaps more centers should be built or better transportation for the Mysalam recipient to access healthcare center should be provided. Next, limitation of the study, which can be categorized into 2. Firstly, data collection. It was quite difficult during the interview process as some of the respondents are in their 40, 50, 60, where the flow of discussion is less controlled. Secondly, the respondent of the study, which primarily related to the language barrier. Since the level of understanding was different, the respondents struggled to respond to the question presented to them. Next, contribution of the study. Firstly, the theoretical contribution. The capability approach theory was used to understand the well-being of healthcare recipient, which was not focused on monetary terms but instead conversion factor to functioning, that is, healthcare assistant. Secondly, methodological contribution, where the qualitative research method was employed to understand people feelings, make sense of reality, to explain and describe the social world, and to develop explanatory models and theories. Lastly, empirical data, where most of the research focus on the healthcare system that is available to all Malaysian citizens.
To conclude that this study will give contributions to the reader to understand more about the healthcare assistance provided by the Malaysian government. Thus, this content of this research study will be beneficial and useful to the governments and other related bodies for the implementation of the healthcare assistance by referring to the Mysalam scheme as a reference to overview the outcomes of these schemes to the public. And that's all from us. Thank you.